project aims to create an application for Microsoft Surface, which can help gynecologists and patients in the conversation during the checkup in the consulting room through the use of animations and interactive tools. Consulting helps facing most of the frequent topics for young girls, such as prevention, contraceptive methods, pregnancy, and specific pathologies. The patient gives her health insurance card to the doctor, who puts it on the surface and opens the menu, starts looking at the patient's data, and asks some information about the patient's situation. The patient is a girl of 19 years old. She's in a relationship, has never had unsafe sexual intercourse, and she has just taken a blood test. The patient asks some information about contraceptive methods. The doctor suggests the use of a birth control pill. She puts the pill on the surface, but the application points out some patient's features that are incompatible with the birth control pill's assumption. So the gynecologist picks up the pill from the surface and puts a contraceptive ring and a contraceptive plaster on it. The doctor clicks on the How to Use It button of the plaster's menu, and the shape of a woman appears. Green and red areas are shown to identify where the plaster should be applied. The patient applies the plaster in a correct way, so the plaster's behavior menu opens automatically, showing the plaster's action, showing how the hormones act on the pituitary gland. The patient chooses the NuvaRing ring, a contraceptive ring, so the doctor puts the plaster aside and starts showing NuvaRing's features in detail, explaining how to use it and the ring's behavior. The doctor explains how to insert the ring, and she invites the patient to simulate this process. At first, the patient doesn't insert it deeply enough, so the ring comes back out and the animation doesn't start. The gynecologist explains to the patient what went wrong and invites her to try again. The patient applies it in a correct way, so the ring's behavior menu opens automatically, showing how the hormones issued from the ring act on the pituitary gland and work to suppress ovulation and thicken cervical mucus, thereby creating a natural barrier for sperm. The doctor explains to the patient the NuvaRing application's timetable with a specific calendar that the patient can download on her mobile phone as a reminder. In the end, the doctor prescribes NuvaRing to the patient. The related prescription appears, and the doctor signs it with a graphic pen, confirms the reception of the prescription. Then, the patient tells the doctor about some recent symptoms she's been having lately, such as itching, abnormal vaginal discharges, and so on. The gynecologist invites the girl to be examined immediately, and after the examination, she diagnoses a candidiasis. They go back to the Microsoft platform, where the doctor puts the pathologist card on the surface, looks up candidiasis, and starts illustrating its symptoms, causes, side effects, and above all, its correct treatment, inviting her to simulate the process of inserting the medication. The doctor explains to the patient that, until she's affected by this infectious pathology, she can not only use NuvaRing during sexual intercourse, but a condom is also required. So she puts a condom on the surface, and the associations with the pathologist card are pointed out. Then, the doctor picks up the card from the surface and explains to the girl the condom's correct application process, showing that it's necessary to press the extremity of the condom to avoid air going inside of it. She invites the patient to simulate the gesture to be sure of a correct behavior. In the end, the doctor returns the health insurance card back to the patient, and the consulting is done. On a surface, the card recognizes a different nationality and asks the user if she would prefer to continue in Italian or French. She selects the latter, so the application shows a start menu written in French with some general topics. The girl selects the contraceptive methods topic, so the contraceptives outlines appear on the surface. The application invites the user to put the chosen contraceptive on the surface. The patient takes the contraceptive plaster, opening the How to Use It menu. The shape of a woman appears, and green and red areas are shown as before. The application, always in French, invites the patient to interact with it. She applies the plaster in a correct way. The plaster's behavior menu opens automatically, showing the interaction between the pituitary gland and the ovaries, as explained in the previous scenario.